Over 620,000 men died in the Civil War. Twice as many of them died from disease, not bullets. The Civil War led to more American lives lost than any other war the U.S. had been involved in. Without the many frontiers of medicine that were broken in the Civil War, one can only imagine how many lives would have been lost. Of the over 60,000 surgeries conducted in the Civil War, 3 out of every 4 were amputations. Civil War surgeons received the nickname butchers because so many amputations were performed. But in reality, amputations were the quickest and easiest way to treat a patient, since they had so many patients to deal with and so little time to do it. Amputations became the most conducted surgery of the Civil War. A normal doctor could complete a full amputation in a little under 10 minutes. A good doctor could do it in a little over 3 minutes. Before the amputation was performed, they tied a tourniquet around the patient's limb above the amputation site to prevent excess bleeding after the limb was removed. A tourniquet is a cloth wrapped tightly around a limb when the patient is experiencing large amounts of blood loss. The tourniquet is put above the wound to prevent blood from reaching that area. After the tourniquet was applied, the surgeon removed the limb. Anesthesia today is a mostly harmless procedure that either numbs a certain area of your body or numbs your whole body, and you fall asleep until the procedure is over. However, anesthesia was very different in the Civil War. Most people think that Civil War surgery was a brutal and painful process where no anesthesia is used, and soldiers have to hold the patient down, but this was not the case since 95% of surgeries in the Civil War utilized anesthesia. Usually anesthesia was put on a cloth, and that cloth was put over the soldier's face to make them insensitive to pain. Ether and chloroform were the 2 main types of anesthesia utilized in the Civil War. Chloroform was usually preferred since it did not require much of it to work, and its effects were rapid. Ether was used less frequently because it took a lot of it to work, and it took about 17 minutes for it to take effect. Another drawback of ether was that it was flammable, and that was very dangerous in the age of candle and gas lighting. For the first year of the Civil War, the Union was without an ambulance corps. They ordered civilians to assist in getting wounded soldiers off the battlefield. The outcome of this was not good because the civilians would usually get scared by seeing the battles and would run away, sometimes leaving wounded soldiers to suffer for weeks. In the first Battle of Bull Run, the civilians who were ordered to assist the Union troops fled, so many of the soldiers were captured and some even had to walk all the way back to Washington, D.C. wounded. Finally, in 1862, under the instruction of John Letterman, the United States' first ambulance corps was established. Once the ambulance corps was established, the corps helped get wounded soldiers off the battlefield and saved many of their lives. They became the blueprint for future ambulance corps later in the war. This was a major improvement of battlefield medicine. Hospital stewards, the combat medics of the Civil War. Hospital stewards performed amputations and many other surgeries for wounded soldiers. The surgeons did not have to meet many requirements to become a surgeon. Their most important requirement was being able to read doctor's notes. They were taught to leave the wound open and clean it regularly until it healed. The hospital stewards would usually learn how to do the surgeries on the job instead of in classes. Though doctors were not well trained, they did their job well, and around 95% of sick and wounded soldiers admitted to the general hospitals away from the battlefield survived. Though the same cannot be said for the South, since towards the end of the war, Southern hospitals were very short on food, and patients had to escape from the hospitals to avoid starvation. Women played a major role in Civil War medicine because the wounded soldiers needed time to recover, and the surgeons did not have the time to stay with any one patient for too long. And since women already had caregiving skills learned at home, they already knew how to take care of the wounded soldiers and help them in their recovery. A well-known woman in the Civil War was Clara Barton, who founded the American Red Cross. Clara started out as a school teacher, but when the Civil War started, she taught herself nursing and cared for wounded Union soldiers for the entire duration of the war. She dedicated her whole life to helping others and never once thought of herself before another person. The Civil War would be the event that ushered brain surgery into common practice in the modern era. The surgeons knew less about brain surgery and head surgery than ancient Peruvian doctors, but they performed the surgery anyway. The surgeons would not become very skilled at the head surgeries because most of the time a wound to the head was fatal. but in some rare cases the soldiers survived. Most of them would not survive long though, because the surgeries had a 57% death rate. Miraculously, most of the time the survivors of the surgeries would not be affected neurologically from the surgeries and would lead fairly normal lives after the surgery. Henry Bellows privately founded the United States Sanitary Commission in 1861 to aid the underprepared and undersized medical bureau, and eventually they also assisted the ambulance corps. The Sanitary Commission advised on the mental and physical health of the soldiers and helped them figure out how to improve both. They assisted in organizing military camps and helped organize temporary hospitals. They inspected camps to make sure that the soldiers had livable conditions and helped with collecting medical supplies. The South would never found a sanitary commission. Months after surgeons saved the lives of wounded soldiers, a very rare few of them got the opportunity to have plastic surgery performed to make their wounds less noticeable. The surgeon's specialties ranged from scar management to facial reconstruction. The plastic surgeons were not as skilled as they are today, so sometimes the soldiers would look worse after the surgeries instead. Sometimes the surgeons would not even attempt reconstruction and just remove bone splinters. Sometimes patients were given artificial facial features so they could speak clearly and eat properly. Historians believe that just under 30,000 Union soldiers lost a limb in the Civil War, with just over 21,000 surviving their operations. In 1862, the Union government agreed to the purchase of prosthetic limbs for soldiers who lost a leg at the knee or above or an arm at the elbow or above. The soldiers were given an option to get their prosthetic limb or receive money from the government each month to assist them. Many soldiers decided to not get their prosthetic limbs because either they did not have enough of a stump at their amputation site to attach a prosthetic limb onto, or they thought having an empty sleeve or pant leg showed their dedication to their country. The Civil War led to more American lives lost than any other war in its history. It set the staging ground for the medical system to evolve so far into what we have today. It led to major improvements in medical techniques and saved over 200,000 lives in World War I and a little less than 700,000 lives in World War II.